Namaskar dosto, hello viewers and welcome to Simply Shefali. From physicians and researchers to clinicians and nurses, the Ottawa Hospital has inspiring women who are changing healthcare. Women at the Ottawa Hospital are trailblazers, leading the way to better the lives of each patient and family that walks through the hospital hallways every day. Today's guest of honor is the Ottawa Hospital's first female Chief of Staff, Dr. DrRoth. Please let's welcome her. Welcome to Simply Shefali, Dr. Roth, and thank you so much for your time and availability.
Thank you so much, Shefali. It is an honor to be here this morning.
My pleasure. It's a privilege of all our viewers to have you on this interview. So a little bit about yourself that our viewers would love to know. Dr. Roth completed her internal medicine and infectious diseases training at the University of Ottawa, and she joined the U.S. Centers for Disease Control and Prevention, CDC, as an Epidemic Intelligence Service Officer with the Hospital Infections Program. She was recruited to the Ottawa Hospital in 2000 as Director of Infection Prevention and Control. She completed an Executive MBA at Telfer School of Management in 2012. Wow. Dr. Roth's clinical work focuses on the care of patients with tuberculosis. Her research interests include healthcare leadership, patient experience, and healthcare acquired infections. She's a full-time professor of medicine at the University of Ottawa and has published over 70 peer-reviewed articles. Dr. Roth has experience, of course, in the medical care and healthcare issues, but she's also strongly known for women empowerment in the Ottawa Hospital. So welcome once again on this virtual interview. Dr. Roth, COVID-19 crisis has healthcare workers, caregivers, innovators, frontline workers, and effective and exemplary national leaders are combating the situation. What are the levels of your concerns?
You know, right now we are in a really challenging time. We're seeing cases go back up again when they were coming down after, the holiday break. And it's tough because I think our staff are getting a bit tired, but I think the community's getting tired too, tired of wearing masks, not seeing family and friends, social distancing. And it really is critical. It really is a critical time right now that we follow public health measures so that our hospitals can keep running until we get more people vaccinated.
Absolutely, absolutely correct. Well, as you mentioned, whatever success the city has achieved is the result of the healthcare professional, the frontline workers, and how immensely and seamlessly you've worked hard with the various health partners and put this together. So, what is the most rewarding part of being a healthcare professional?
Well, I would say it's really that human impact, the human touch. I think through the pandemic, what we've seen on the front lines is colleagues watching out for each other, without warning, people have an exposure or they have a symptom and they need to be off to get tested. So it's really watching the teams support each other through that, but also the concern that we've seen for, colleagues' life outside of the hospital. So like you all, we have kids and we're trying to navigate and virtual learning, caring for older parents. And so it's really been rewarding, I think, to watch that level of kindness and care that our staff have been showing towards each other.
That's wonderful. And as you mentioned, that with the success of healthcare professionals working, we finally have vaccinations all over the globe. It's a sign of rejoice for everyone. And the monumental day was December 15th when the first vaccination was administered. So how was it like to be one of the first sites administering the COVID-19 vaccine in Canada?
You know, it was a real honor, I would say. It was very inspiring. Our at the Ottawa Hospital, our motto, our tagline is inspired by research, driven by compassion. And that was really a moment where, you know, world-class research from scientists around the globe came together to that, you know, compassionate care of being able to sit face to face with workers in long-term care and thank them for what they've done and be able to give them something to protect them. So it was very touching, I would say.
Absolutely. And during this pandemic, most of us have learned that count your blessings, right? What have you learned in this pandemic situation?
I think gratitude is absolutely critical, what you've just mentioned. I also think we've learned that it's important to take care of ourselves and each other. If we're not well, you know, you think of the oxygen mask on the plane, take care of yourself first. Personally, what I learned was how to take a micro vacation. And by micro vacation, I mean, you know, a block of 2 or 3 hours where you're not checking email, you're not taking, you know, virtual calls, you're not on social media, you're just pandemic free for 2 to 3 hours going for a walk or doing something enjoyable. So I really think, I like the gratitude example you brought out, and I think being kind to yourself is another lesson learned.
Perfect. These are life lessons, right, Dr. Roth, that most of us will be taking with us even after the pandemic is done.
I hope it's changed us for the better. I agree completely.
Of course. And what would be your advice to aspiring research scientists and aspiring medical students to thrive in any case of like pandemics or any such situation?
Do you know, I would say it's a really exciting time to be in healthcare, both on the research front, but also on the clinical front. This is really unprecedented when you look at a completely new virus that we've never seen before. And within a year, we've got, you know, the scientific expertise and knowledge around the world to have a vaccine in people's arms. And so I think that ability to really make a difference, the pandemic has highlighted that. And so for those of you who have any interest in research or clinical care, I would say go for it. It really is a very rewarding field.
Absolutely correct, and also doing for the better good of the community.
For sure, that's what's rewarding about it.
Of course. So, Dr. Roth, we also have a lightning round in my talk show. What we try to do is bring in a little bit of a softer and personal view of the guest of honor. And if you're okay, can we start with the lightning round?
You bet.
All right. So what are your hobbies? Like, do you listen to music?
Well, you know, I'd say my first go-to is gardening. Of course, not at this time of year, but there's something about getting in the dirt and working with nature that's really refreshing. I do listen to music. I actually try to listen to classical music because there's more and more evidence out there that it's good for your brain, and it helps relieve stress. So classical music is sort of my go-to.
Perfect. So gardening and music. That's lovely. So whenever you get some break, you do your gardening, you do your music, and what would be the first thing after this pandemic that you would like to go for vacation? Where would you like to go?
Well, we have a family vacation to Italy that's been on hold for a year now. In fact, it was the morning we were supposed to leave that they shut down all the museums in Italy. So our kids are very much looking forward to when we can get back on that plane and get back there.
And I wish all the best, and I hope you go with your family and earn that you have earned that vacation. Well,
It'll be even more special then.
absolutely. So, which is the fictional character do you believe is like you?
That's the hardest question I think I've ever been asked in my life. Um, so if I had to give an answer, I'd say maybe an adult version of Lisa Simpson. Hopefully kind, very organized, but I don't play the saxophone.
But you do listen to music, so you have one
Absolutely.
element covered. Excellent. Thank you for answering that. And what would be the first thing you would do if you were in zero gravity?
Do you know, that's also an interesting question. I think I'd like to see if I could fly, or at least pretend I'm flying, maybe jump off a table or something and see what happens.
Yes, and see how we land back. And the last question is, if we believe incarnation exist, what would you like to come back as?
I think some kind of bird. Maybe a chickadee, because they seem very cheerful and carefree. But yeah, I think a bird.
Wow, you really love nature, eh? But if you ask me, we would like to definitely bring you back as Dr. Roth, someone who has made humongous contributions in the fields of healthcare, medical care, and also someone who is so empowering for women in this field. Thank you so much, Dr. Roth, for your time, for your inputs. I know you're very busy, but thank you very much for coming on Simply Shefali.
The pleasure is mine indeed. Thank you.
Thank you so much. Dear viewers, this was Dr. Virginia Roth for you. Thank you very much, Dr. Roth. Once again, have a great day.
Thank you. Bye-bye.